Hello, and welcome to the Clinical Liver Disease video series. CLD is an official digital learning publication of the AASLD. I'm Sarah Repking, nurse practitioner with Rush University Medical Center in Chicago, Illinois, and an associate editor with CLD. I'm here with Dr. Monika Sarkar, who is an associate professor of hepatology and liver transplant at UCSF. She's also the director of the UCSF Women's Liver Program. And she is also a co-author of Contraception in Patients with Liver Disease and Liver Transplant. Dr. Sarkar, thank you so much for joining us today.
Yeah, thank you for having me.
So a couple questions about this great article. There are so many available contraceptive options. Is there a simplified way for hepatology providers who probably don't have a good handle on them to remember the basics of it?
Yeah, no, that's a fantastic question. And I would say it's pretty simple in that there's contraception that has progestin only when we think about hormonal exposures, and those that are combos, meaning they have progestin and estrogen. And it's really the component of estrogen where we have to think about certain patient populations that might not be as safe for use in the context of liver disease. So between those, the progestin only options can be used in any of our patients who have liver disease, regardless of the type of liver disease or the severity of liver disease. So it's really only the category that contains estrogens that we have to think about a little bit more restricted use in certain patient populations. And that's really those with Budd-Chiari, because they have an underlying hypercoagulable condition, those patients who have progressed on to decompensated cirrhosis, because they have impaired estrogen metabolism. Most of these are metabolized primarily by the liver. So we get worried about estrogen-related side effects. And then our patients who have hepatocellular adenomas, which all of us as hepatology providers know that estrogen really promotes the growth and then increases the risk for a subsequent rupture of those liver lesions.
Great. That's so helpful. Thank you. And can you comment on the relevance of contraception in light of growing restrictions to pregnancy termination?
Yeah, no, that's a fantastic question. So it's really important, I think, for us to take a bit more ownership on the hepatology side to at least ask our patients, are they sexually active? And if so, are they using contraceptive agents? Because for many of our patients, depending on where they live, if they have unprotected intercourse, they may have no other options to prevent an undesired, unplanned pregnancy. So it has really big implications when we think about our adolescent patients, for example, the growing risks for worsening socioeconomic disparities for patients who are young or older who having an undesired, unplanned pregnancy might really limit what they have as far as the financial, more financial challenges with having to raise a family or having a child when they're not in a position to do so. When we think about different career opportunities and educational opportunities, especially for our adolescent patients and young patients, where that might not be an option when they're now having to raise a child in the context of an undesired, unplanned pregnancy. And then also just these are medically complex patients who have underlying health conditions, and then the risks that both a pregnancy may pose for their own liver-related health and then during the context of pregnancy, but then their ability to follow up and get adequate care and take care of themselves when we think about our liver transplant recipients, our patients who have advanced liver disease, as we're seeing more advanced liver disease in younger and younger patients with MASLD, MET ALD. So really relevant to think about doing what we can in clinic to preventing these undesired, unplanned pregnancies, because there's a breadth of contraceptive options that are safe in our patients.
And I think that segues so well into my last question. So for hepatology providers who we're already so strapped for time, we have to go through this long list, especially they like decompensated cirrhosis, even compensated cirrhosis. What's a really simple way for us to enhance our clinical practice around sexual health for these patients? Do you have a couple questions that you always ask women of childbearing age or, men of, men of all ages really, but is there a simplified way that we can do that when we have just a short time with these patients?
I would say add it to your clinic template. So, you probably have dot phrases where it just populates, HCC screening, varicose screening, put family planning, and just simply say, are you sexually active? Are you using any form of contraceptive if you're hoping to prevent a pregnancy? And then in my dot phrase, and even those who aren't as savvy with talking about these things, you can simply have a dot phrase that says, you know, the breadth of these contraceptive options, hormonal contraceptive options, are safe in the context of their hepatitis B, you know, whatever it is. Progestin only IUDs. So IUDs, the hormonal IUDs are only progestin only. So anybody with liver disease can use them. There are absolutely no restrictions in our patient population. And so I think it's really important to, if you even put that in your dot phrase, these letters are going to their primary care providers. And so I think when they get buy-in from us about the more nuanced, what's safe, what's not safe, it really helps to start dispelling some of these myths, because we're not the ones who are prescribing contraceptives. It's the, you know, their PCP, their family, their women's health provider, their OB. And so if they really see documentation that we deem it safe as the people who are taking responsibility for their liver disease, it opens up so many options for our patients to get access, again, to the breadth of contraceptives that are really safe for them and can help them to really honor their reproductive wishes if they don't want to have a pregnancy.
Dr. Sarkar, that was fantastic. Such a wealth of knowledge, and I think so relevant to all of our practices. Thank you again for joining us for another installment in the Clinical Liver Disease video series. And thank you to all those watching for joining us. On behalf of all of us on the CLD team, I hope you found this interview helpful. And for more information about contraception in patients with liver disease and liver transplant, please visit us at www.cldlearning.com. And thanks again for watching.
Thanks.